There are other types of hypertension which include resistant hypertension. When you say resistant, it means that blood pressure is consistently high, regardless of what you do. Medications you take to reduce the blood pressure will not work. Other measures you do or take to reduce the blood pressure will not work. In such a situation, there is resistant high blood pressure. It is very difficult to control, even with multiple medications. Then there is what we call white coat hypertension. In white coat hypertension, it is funny but true. You will discover that blood pressure readings are very high when the individual gets to the hospital. As you are listening to this, I know some of you will be saying, yes, it used to happen to me. In such a situation, you will just discover that when the person gets to the hospital, the blood pressure is high. And when the person gets back home, the blood pressure becomes normal again. That is what is referred to as white coat hypertension. There is also what we call masked hypertension. In masked hypertension, blood pressure is normal when the person gets to the hospital. But when the person gets to other places, the blood pressure increases, including the house or the home. The fact is, there may be the particular reason for the blood pressure increase in the house. So when the person gets to the hospital, the blood pressure becomes normal. But when the person is at home or in some other places, the blood pressure is high. So in such a situation, you need to check what exactly could be responsible for an increase in your blood pressure, apart from the other natural factors that we have talked about. Then there is what we call nocturnal hypertension. In nocturnal hypertension, the blood pressure increases at night. Usually when medications for blood pressure are taken, it is advisable that blood pressure medications are taken in the morning. After food in the morning, blood pressure medications are taken in most instances, because it is in the morning after food that majority of actions, activities, and all those things that have tendencies to increase blood pressure take place. So if you take blood pressure medications at night, you will discover that you may not be able to control your blood pressure as such, because usually you do not have so much of activities at night that would increase your blood pressure.